I think the most important thing is to remember that when parents receive news that there's a diagnosis or even that there's an atypical screening result, most parents experience that as a traumatic event. So the research indicates it's 88% of mothers, 83% of fathers. So being thoughtful about preparing parents for the testing that they're having and the possibility of results that they may not expect, informed consent around testing, as well as being mindful of how that information is delivered, so that you are providing parents at the moment that you're telling them something's wrong with additional support.
Yeah. Hello and welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or APLOG. On this podcast, we bring on experts who can provide insights to help medical professionals in their life-affirming practice and career. I'm Miriam Diallo, APLOG's Communications Manager. I'll be your host for today, and I'm very excited to be back on with Tracy Winsor, the Training and Service Development Director at Be Not Afraid, which is a nonprofit that supports parents who are carrying a pregnancy to term following a prenatal diagnosis, supporting them through pregnancy and beyond. Tracy, thank you so much for being back on with us.
My privilege.
Of course. And last episode, we did do a bit of a deep dive into your organization itself and the services that it provides. But this time, we thought we would dive into a related topic, which is your advice for medical professionals who are trying to best serve patients who are dealing with what your clients are dealing with, which is an adverse prenatal diagnosis. So thank you for agreeing to dive into this topic. Yeah. Let's just start with a high-level overview of what we're about to talk about. So broad level, what are some tips that you have for medical professionals who are trying to support patients dealing with the very difficult situation of an adverse prenatal diagnosis?
Yes, I think the most important thing is to remember that when parents receive news that there's a diagnosis or even that there's an atypical screening result, most parents experience that as a traumatic event. So the research indicates it's 88% of mothers, 83% of fathers. So being thoughtful about preparing parents for the testing that they're having and the possibility of results that they may not expect, informed consent around testing, as well as being mindful of how that information is delivered, so that you are providing parents at the moment that you're telling them something's wrong with additional support, answering any questions they have, trying in real time to be supportive in that situation. We find with informed consent, the big offender right now in terms of testing is the NIPT test. So often parents are completing NIPT because what they really attached to was the idea that they could find out gender, boy or girl, quickly, may not have been anticipating the possibility of some other test result relative to genetics or some increased risk relative to genetics because nobody thinks it's going to happen to them. So really, letting parents know that there's the potential for some additional testing results that may be concerning to them before they take the test.
Yeah, those are some really useful tips, just things to keep in mind as to where patients are at when they're navigating this pregnancy journey, whether they're aware that there might be something wrong or they weren't even aware that you were testing for
Right.
something that might be wrong. So those are some important things to keep in mind, the trauma aspect, the informed consent aspect. Let's dive into the language a little bit more. What are some thoughts that you have about the language that medical professionals should be using surrounding these prenatal diagnoses?
Yeah. I think it's language and then also messaging. So, for instance, it would be very natural to say, I'm sorry to have to tell you your baby has trisomy 21, Down syndrome. But it's probably better to say, I'm sorry that this has happened. Less judgment about baby. I'm sorry that you're going through this. I know that no one expects a result like this. And then the offer of support. That's why we're here and we can work through this together. But to be careful about how you message the news when you give the news and that it's not in some way communicating something you don't anticipate to or you don't intend to communicate about baby. Additionally, we see still a lot of lethal language used around diagnoses or like certainty about prognosis of certain diagnoses, trisomy 13 and 18. And I think in our last time together, we talked about the great resource that you all have, the video on trisomy 13 and 18. Likewise, anencephaly, sometimes primary brain anomalies, doctors will say this is lethal or this is futile. That may be what was presented to them in medical school. We know, we have the research now that indicates that these should be referred to as life-limiting diagnoses. That means there's some uncertainty about the likelihood of death and the timing of death and whether or not a baby with a particular diagnosis will benefit from care at birth. Sometimes providers feel like, well, better if I get parents ready for the worst case scenario, and then if baby's better than expected, that'll be better. What we actually know is that trauma occurs again if baby is different than the prognosis parents have been provided with, and that there's trauma whether the baby is worse than expected or better than expected. So it's really best to let parents know when there's uncertainty. I think that's it for language and messaging.
Yeah, those are some really important points. One, the point about not trying not to sound like you're putting any blame on the baby for, the condition that he or she was created with. Also the point about trauma and prognosis. I've definitely heard physicians talking about how they want to be as realistic as possible and potentially erring on the side of conservative estimates for the prognosis because, as you said, if things turn out better than expected, then that's a good thing, right? But that's an important point to mention. Your research showing that if there's too much certainty, if the physician presents a prognosis with too much certainty, then there might be trauma for the parents if it turns out much better or much worse. So
Yes.
it's important to be a little bit more measured in the way that physicians present those prognoses. So yeah, thank you so much for those points. And I also wanted to mention that Be Not Afraid does have a document titled Trauma Informed Care for parents with a prenatal diagnosis, and that might be helpful for medical professionals as well. Just some tips on how to be mindful of how traumatic this situation is likely to be for parents and how you can best care for them given that. One of the points that's mentioned in this document is the importance of providing connection. Can you speak a little bit to what that means and what that looks like?
Yeah. Connection is the antidote to trauma, and it can actually be preventative in terms of helping parents deal with additional difficult situations that may be ahead, which is often the concern when we hear from a pro-life OBGYN. They know that they've had some atypical finding. They're going to have to refer a parent to an MFM. The connection that they provide to that parent at the diagnosis will be helpful as the parent moves forward to the MFM, which we often can anticipate to be another difficult conversation. In terms of things to do, it's about being available and attentive. Certainly, I think the delivery of the information of the test result is important, and that be personal in some way. It doesn't necessarily have to be that the doctor does that, but perhaps their nurse with some additional sensitivity to providing the information to parents. We should be able to answer questions honestly. If that means there's uncertainty instead of, as I said, suggesting certainty of prognosis. I think it's always great to make a plan for follow-up. We're giving you this information now. We understand this is a lot of information to absorb. We anticipate you'll have questions in the next couple of days. I'm going to check up on you via my chart. So be looking for that so that I can help you with any additional information you need. And then I think involving others carefully. So often our pro-life doctors are working within practices that aren't pro-life practices. They're working at hospitals that aren't pro-life hospitals. So I think just being mindful that the people you involve with your families are maybe even have a heads up. These parents have made the decision to carry to term. Please know this is a Christian family. Just some preparation on the referral side, and then also, we'll talk about this in a minute, helping parents anticipate maybe what might be the complications of a particular referral, like the MFM, where there might be a difficult conversation.
Wow, so it seems like a lot of it is about making sure that they feel supported and they don't feel alone in what is definitely a very unexpected and
Yeah,
kind of a situation that would definitely throw them off into a uncharted territory. Um,
absolutely.
I love the point that you made about alerting colleagues, because it's or patients all have they should have the support of a full care team. It's not just you. And I've definitely heard from friends who have dealt with adverse prenatal diagnoses and chose to carry to term that they have gotten just kind of offhand demeaning comments from the medical professionals that they have been getting care from after they chose not to terminate the pregnancy. And so it's not just about the life-affirming physician or medical professional's individual response, but it might also be good to give a heads up to the colleagues and make sure that they are committed to being as supportive as possible
Yeah.
to these parents and their
Well, just that they know something about the patient that's coming to them. I
absolutely.
think one of the most difficult things, I'm doing an interview later today with a BNA dad. Baby had a heart defect. And I
Mm,
think in going back over our conversation, I think abortion was offered 4 times to him within the 24-hour period, to he
mm,
and his wife within the 24-hour period of the diagnosis. It was offered, I don't think they had a pro-life OBGYN, but I think it was offered by the OBGYN, the maternal fetal medicine specialist, pediatric cardiologist, genetic counselor. Like at some point, it might be helpful for all of those people to know this is a very specific kind of family. And they've already asserted to me they're Catholic and they're going to carry to term no matter what, or they're evangelical Christians and they're going to carry to term no matter what. It may not change what that other person does, but it might. And so maybe that's a way to help parents.
right, absolutely. And even for pro-choice medical professionals who feel like it's their duty to inform their patients of all their options, it's good to know that, at some point, it's been established that they're deciding to carry as long as possible. And so being supportive of them means accepting that and making plans for them and their child based on that knowledge.
Right.
Um,
Moving beyond that decision.
yeah. Speaking of uncharted territory, I suppose, what are some other thoughts that you have about how to help parents navigate this unexpected situation? A lot of parents expect their pregnancy to go smoothly. They have the exciting 20-week ultrasound where they find out if it's a boy or a girl, and for most parents, they expect it to be a happy occasion. But with nip testing or the 20-week ultrasound, it doesn't go that way for a lot of parents. So for parents who are dealing with this unexpected situation, what are some thoughts as to how medical professionals can support them?
I think a good example in this case, again, is the one that we hear about where a pro-life OBGYN calls us and says, now they're going to have to go to MFM. What do I do? Um, so I think kind of what I suggested before, giving them an idea of the roadmap ahead. Um, Even if it's just a heads up. So if it was a hospital system that I was familiar with and I knew the MFM and I knew kind of what their talking points were going to be, I might say to a parent, it's entirely possible this person's going to offer abortion. That's a pretty common response. You certainly have the right to tell them ahead of time, we've already made the decision to carry to term. We don't have to talk about that. There's probably going to be some conversation potentially about quality of life. And then, a little bit of help about what they can do about that. Again, we recognize this baby may have a disability. I think also letting parents know where there's going to be a decision point. You're going to go to the MFM, they'll probably do an ultrasound. My guess is this person's going to offer an amnio. And then also, relative to this decision point, oftentimes parents feel like the decision has to be made right now. So it's perfectly acceptable to prepare parents for that MFM and the offer an amnio by saying, you know what? We need to go home and talk about this before we make a decision about an amnio. Can we do that? So that you're just kind of helping the parent understand where there's going to be a new twist or a new turn or a new moment where they feel unprepared. You're preparing them ahead of time. And then I also think kind of like checking for understanding, again, doubling back. After you see the MFM, please reach out to me via my chart or give the office a call and I'll follow up. We'll see if you have any questions that I can help you with. I think another really important thing for parents about experiencing prenatal diagnosis about the MFM is that letting parents know that MFMs don't treat living children. Oftentimes they know what the OB is. They know that. They understand that. Most parents have never met an MFM or a perinatologist before. And there's a lot of confusion sometimes about who that person is. And if that person is giving you a negative prognosis, what does that actually mean? So parents benefit from knowing. Even at the MFM's office, they haven't connected yet to anybody who treats living children with the condition that's been screened positive for or diagnosed.
That's an extremely useful insight, just helping parents navigate that situation by preparing them
Yeah,
as to what's next at more than just a very minimalistic surface level. Explaining who MFMs are, perinatologists. A lot of parents might not know, and it would definitely help them feel a little bit more at ease if they know what to expect, even in this unexpected situation. Prenatal diagnosis offers
sure.
enough uncertainty as is, and so helping to alleviate that as much as possible seems extremely important. Is there anything else other than the anticipation aspect or helping them, know what to expect? Is there anything else you would say is important?
Yeah, and I kind of alluded to that. A traumatic event is a profound loss of safety. So parents get into that prenatal diagnosis. They think they had everything they needed, that they were completely prepared for anything. They get into a diagnosis story and they suddenly are like, oh, this is a terrible thing has happened and I don't understand and I don't have what I need. So when we talk about helping them on the uncharted path, part of that is preventing the next possibility of a moment that's a difficult moment. Some might say re-trauma. And then, as I was saying, you can say to parents, if they're going into the MFM, maybe start the conversation by, thank you, it's great. We really appreciate having the opportunity to meet with you. We've already made the decision to carry to term. There's nothing you can say to us going to tear. That's about giving parents agency. It's kind of giving them some tools so that they can begin to enter into situations, because they're going to be there, where it's difficult or they're not understood or there's a lot of uncertainty. Entering into those situations with some tools. So, kind of prepping them and what they might want to say, that can be helpful. I think educating with printed and online resources, offering drawings, if you're telling them about a potential, let's say an omphalocele, kind of draw that out. It's not so much that they may need it in the moment, but we know with trauma that executive function is impacted. And so parents may be sitting there listening, but their ability to remember what you said later might be impeded. So providing them with things that they can take home, even like a drawing, can be really helpful. Writing down words that are unfamiliar, which are going to be most of the medical words that are flying past them. Providing research assistance. I don't know that answer, but you know what? Let me see if I can find that answer. And then a really big one is that, people who are trying to come to terms with a traumatic situation, who've had this experience of I'm not safe and I don't have what I need, they benefit from other people saying to them, I respect your decision to carry to term, and I know that you'll be able to make good decisions for yourself. We're just going to make sure you have the information you need. I know that you're a discerning person. You're going to be just fine. That is kind of the difference between let's talk about abortion again, which is kind of undermining. You've made a decision, but I'm not sure you really thought this through. So to be the person who's kind of affirming them, this is a good decision. We know from the research it's the best decision for mom, even if the baby's going to be lost. Emotionally, it's the best decision for mom. So just kind of building them up, providing them with the tools, making sure that they have understanding, and then letting them know that you trust them. They've made the most selfless decision they could make, and you trust them to make the additional decisions they have to make.
That's a really good way to put it. And certainly, what you said now about empowerment and what you said before about anticipation, those are definitely connected, right? The more
Yes.
empowered patients are with knowledge about what's going on, what's going to happen next, the more they feel like, they're a little bit in control of their situation. They're making decisions for their baby as opposed to having a lot of things happen to them.
Yes.
Um,
And we're talking now about what medical providers can do, but the truth is, refer them to care like the network that we're providing nationally. This is a lot for a doctor to take on, or even a nurse within a practice to take on, which is why we have supportive services that can be addressing these things while a patient is being followed in your office. So that's another consideration in terms of the uncharted path and agency, is make the referral for them to get additional support.
Absolutely, absolutely. And we'll definitely round back to some sources of support at the end, just some quick recommendations for resources. But before we do that, one last question. We kind of alluded at the beginning as to the not putting blame on the baby and the language that you use. Why is it important to talk about the baby in the right way in
Yeah.
this situation?
Um, a couple of reasons. I think if someone's traumatized, they can have experiences of fight, flight, or freeze. Certainly, flight can be problematic, especially if the abortion is made, the offer of abortion is made quickly. If a person is thinking, if you think of like a prenatal diagnosis, like a theater on fire, and you suddenly realize there's smoke and you stand up and if you're in flight mode, I got to get out of here. Somebody opens the door and the one door that's opened is abortion. Um, we have to have an actual response then to that baby. I think from a parent perspective, even if they're not in flight, the offer of abortion is maybe the most profound rejection of a child. And so often these offers of abortion are made at the fetal center, at a child's hospital or children's hospital. I mean, they can be made in places that are even more more meaningful for parents in terms of the rejection. Like all these other kids have care here, my baby is not going to have care here. So our belonging, our communication of belonging for baby is important. So this is about using baby's name if you know the name. This is about talking about the gender. If there's no name, this is your sweet boy. I think there's some perspectives that you can provide to parents. This sweet baby, you're going to be, as a result of this diagnosis, you're going to be meeting all other kinds of people, a lot of people, and they all have a different relationship with this baby. Your relationship is unique in that you're the parent of this baby. This baby belongs to you. And all these other people have relationships that would be easily dispensed of when this story is over, but you have to be comfortable with the story, the ending that you have to live with for the rest of your life, whether it's living with a child with disability or living with a child that you lost. So sometimes helping parents understand that baby is still theirs and everybody else has a different relationship can be very helpful. It can also be helpful to say, this is the same baby that you were pregnant with 2 weeks ago. This is the same baby. I remember when you got that positive pregnancy test after trying for so long. It's the same baby. We know more about that baby, and some of what we know is scary, and there's a lot of uncertainty, but baby hasn't changed. This is the same baby you've loved all this time. And then I think if someone can make a commitment to the birth, I know it's hard in large practices to be able to do that, but it's very meaningful for parents if they have a doctor that they feel attached to or someone that they sought out because they were looking for a pro-life doctor, to be able to say, even if it's, I'll do everything I can possibly do to be here to deliver this baby, or even if it's stopping by to meet baby, maybe you don't deliver the baby, but you're going to meet that baby the day after their birth when you're on service. These are all important ways to communicate that baby hasn't changed and baby belongs to them in a unique way, but also belongs to you as a pro-life doctor in a meaningful way.
Absolutely, absolutely. And yeah, pregnant or expecting parents are in a unique situation in that they're preparing to build this relationship with their child. And in some ways, medical professionals with the medical understanding they have of their child knows some things about this child that the parents don't know. And so it's important to wield that power in a responsible way as medical professionals, showing that that you're committed to loving the child in the same way that the parents are preparing to. The way that you talk about the preborn child really sets the tone for how parents are to think about their child. So
Yeah, I'm just going to throw this out there because we have a little bit of time to say it. I was just on the phone with a mom
mm,
who's caring to term a baby with anencephaly, and there was a point at which she was disclosing some of the things she felt, and I said to her, with a prenatal diagnosis, there's a lot has lost, but parents oftentimes think more is lost. She was saying, I'm not going to get to welcome my baby. I'm like, yeah, you are going to get to welcome your baby, right? Your baby is still going to benefit from the time that your baby is with you. Your baby's going to know you. Your baby's going to find comfort with you. So sometimes too, it's communicating that, like the prenatal diagnosis doesn't change everything about a baby. a neonatologist I know will say, congratulations, because the primary diagnosis is you're still having a baby. And so being able to say to parents, this baby's going to be more like every other baby than different at birth. That's a truth. That's why we're pro-life people. That's what we believe. So sometimes parents just need to hear that little bit of more perspective from a doctor who's willing to share it from their own pro-life beliefs.
Absolutely. And yeah, earlier this year, I did interview Dr. Robin Perucci, who's a
Yes, she's
neonatologist.
the one.
Yes, and she spoke about the approach that she takes to caring for children with life-limiting diagnoses. And so if you want more insights from her perspective, feel free to browse through our episodes there. Yeah, as we close out, as I just wanted to mention that APLOG does have a link to the Be Not Afraid's parent care coordinator training on our website on the resources page. Uh, yeah, Be Not Afraid does provide this kind of training to medical professionals. So if you want to learn more about how best to support parents in this situation, feel free to take advantage of that. Tracy, did you have anything else to say before we close out?
I just wanted to say, when we developed the training, our service, I'm not a medical person, and our other parent care coordinators weren't. It's been very interesting to me who we're training for the organizations that are developing the service are nurses and nurse practitioners. And so if anyone has any concern about referring to a network that's not medical, I can promise you, I think we have one parent care coordinator out of 13 that doesn't have a medical background. So these are really, and they're really like people with like 27 years of experience in NICU and OB, 20 years of being a NICU nurse. They're medically credentialed and qualified people that are prepared to provide this extra level of trauma-informed care on top of the medical care that's being provided to parents. So refer.
Absolutely. And that's good to know, Tracy. Thank you so much. And thank you so much to our audience as well for joining us today. If you like this episode, be sure to give us a like on YouTube, subscribe to our channel so you won't miss any episodes. If you're listening via a podcast app, give us a 5-star review because that will help us reach a larger audience. And yeah, we will see you next week for our next episode.